Okay, so good evening, good morning, depending on where you are now. So I'm Li Zhenxi. I'm a professor and also the chair of the Department of Global Health Policy and Management in the Tulane University School of Public Health and Tropical Medicine. And I'm the hoster for today's presentations for the COVID-19 outbreak modeling and the resources. So I like to give you a little background about this project. This is a kind of joint project by the scholars and professionals from the Centers for Geospatial Analysis at the Harvard University, the Geocomputation Center for Social Science at Wuhan University, the China Data Center, the Spatial Temporal Innovation Center at the George Mason Universities, and some other very important like China Data Lab, and also some sponsored by one of the insurance company, Taikon. And I'm also president of the China Health Policy and Management Society. It is also the co-hosting this event. So I'd like to introducing the first talk for tonight. You can see the screen. This is prediction and role of interventions and implication of national lockdowns on the COVID-19 outbreak in India. So the presenters is going to be presented by a team led by Dr. Mukherjee at the University of Michigan, and she, I believe, is the first women chair for the department, and that's very, very, important to mention in this talk. And then she's going to join two of her colleagues for this presentation. So without further ado, I'd like to give the floor to Dr. Mukherjee. Welcome.
Thank you, Li Zheng, and thank you, Shumei and Peter and everybody for giving us the opportunity to present our work on India. And thanks to all of those who are joining from all across the world. I can see on the screen different parts of the world being represented, different time zones. So it is 9 p.m. in Ann Arbor. And probably this is the latest seminar I have ever given in my life. So that is an interesting experience, but I'm really looking forward to this experience. So we present this work. We have always presented this work as a team, because this was a truly teamwork. And I want to share a little bit of the history of our team. So we started working on this project on March 16th. That was the first day of the stay-at-home orders in Michigan. And many of us were very worried about the world, what's happening with COVID-19, particularly about our parents and loved ones in India. And we saw what has happened in Wuhan, what was happening in Europe, what was exploding in the United States. At that time in March, India only had about 500 cases and 11 deaths. But still, we wanted to do something. So we wanted to repurpose our anxiety into something meaningful. So we formed this team, and this is primarily from University of Michigan. And fortunately, at that time, Peter Song, my colleague, who gave the first talk in this series of lectures, and his graduate student, Lily Wang, were really working on the model for China and the ESIR model that you're going to see. So we had those tools nimble. So we worked on a team together to produce this work, and to share the team spirit, we take turns in presenting this work as well. And we called our group the COVID-19 to emphasize that we are working on the crisis of virus in India. And as I said, that before I begin this talk, this is a very unusual talk for a statistics audience, I feel, because so much of statistics and data science are now ingrained into public health, healthcare, social support, financial crisis. So it's an integrated picture as we think about COVID-19 as the generational defining crisis of our time. But I wanted to take a moment to thank all the healthcare frontline health workers who have been taking care of COVID-19 patients across the world. Hats off, and thank you very much. So our work, as I mentioned, that this started as a very unusual format. So as an academic, I have never really published in non-peer-reviewed journals. So our modus operandi usually is that you have an idea, you work on it for months, and then you submit it to statistical methodology journals. It takes months to review, and then you ultimately see the publication, and it may be 2 years after you started a serious idea. But here there was pressing need to get the message out. So our team really worked relentlessly, sleeplessly for 3 days in order to produce a report which was released. So we started on March 16th. We released the report, as you can see, on March 20th. And since then, we have written several Medium articles. And I strongly encourage one of the success of these projects is really on the app, which updates daily with the model projections at covid19.org. And then our paper actually appeared in the special COVID-19 issue of the Harvard Data Science Review, which is a fantastic issue with wonderful contribution on a holistic approach and treatment of COVID-19 from a data science perspective. And so I strongly encourage you to look at that. And with that, today our presenters are going to be Debashri Ray from Johns Hopkins University. She's an assistant professor of epidemiology and biostatistics. And then Rupam Bhattacharya, who is a graduate student in Michigan. Max Salvatore, who is an incoming graduate student as a research staff in my lab in University of Michigan. And then I'm going to come back and synthesize some of the work as well. So I hope that you find our presentation interesting, and I look forward to the conversation and the discussion as well.